Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're going to talk all about nasolabial folds and how to treat them. The reason I picked this topic is that I've had a slew of consults for this recently, so I thought it would be a good idea to explain why I do what I do and the rationale behind it. So first of all, the reason that you start noticing these creases as you get a little bit older in age is, again, due to my favorite topic of aging, bone loss of the midface, okay? So you start losing some of the support along the cheek. You also start losing some of the support deep in here. And so you can imagine that everything starts to fall down. And that's why you get this excess fullness right here. I do have some of that. So this fullness right here actually was probably originally up here on me. It's fallen, so that's why it's starting to create these divots here. So how do we treat this? We basically need to add back that lost volume. So the three areas that I talked about include, like I said, the cheekbone right here, deep in here, this area is called the piriform. It's right along your nose. And then you can very carefully also do it in the actual area of the nasolabial fold. However, you do need to be careful there because there's a very important blood vessel that snakes its way around here called the angular artery. And if you hit that vessel, you can cause a lot of problems and complications. So, what can you add it back with? You can add back the volume using fat surgically, or you can use filler. Either of them are decent options. At the end of the day, you do have to know, and I try to explain this to all my patients, that this is only temporizing the issue. At the end of the day, you do eventually just need to lift this back up to here where it used to be, and unfortunately the way to do that is with a facelift. However, obviously there's not a lot of patients who come in and are immediately ready for that, so sometimes you have to start preparing them for that, prepare their expectations. I want to show you some cool effects as to why we add these areas. So you can see my folds. If we add filler or fat along the cheeks, study my folds, see how they get a little less obvious, okay? This is what we're doing at the filler. It's kind of like I'm pinching this, and so it's pulling up the skin here. You have to be careful about doing too much of this because that's how you start getting that chipmunk face, which we don't like. The other place is the piriform, deep in here, and I'm gonna show you with this Q-tip how this works, but it's kind of weird, so bear with me for a second. If we push this area out, it makes the fold look less deep. Now this is obviously a dramatic example, but that's the rationale behind what we're doing there. So, in summary, nasolabial folds, easily treatable, but just be careful. And that's it on Face the Facts for today. I hope you enjoyed it. Again, my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in DC.